Assalamu alaikum. My name is Dr. Muhammad Solatni. I'm a senior registrar in surgery in Shalamar Hospital and Medical and Dental College. Uh, this is a topic of skull fracture that we're going to discuss today. So, what we're going to do is initially discuss the basic anatomy of the skull, then to go ahead, what are the skull fractures, type of the skull fractures, what are the causes, symptoms, how to diagnose a skull fracture, and management of the skull fracture. So the bones of the skull and the cranium. So this is basically a frontal view that shows here. This is a frontal bone. All right, this whole area of the skull is being covered by the frontal bone. So coming to the next one, there's a parietal bone on sides, which is a pair of the bones. So out of the frontal bone here, this usually occupies the lateral aspect of the frontal bone, which is the parietal bone. Here, just below the parietal bone, you've got a temporal bone region here. These two are the temporal bones. They basically cover the area of ears and just lateral to the eye orbit. There is a point called pterion just between around the temporal bone and the parietal bone around here. So that is the weakest point of the skull. This is more likely to get injured in a skull fracture. And if it gets injured, there's a artery just lying beneath that point, which is called middle meningeal artery, and which can rupture to cause extradural hematoma. So this is the nasal bone, as you all know. Here it comes femur, just behind the nose. These are the zygomas, zygomatic bones. This usually continues as arch. This is the maxilla. This area over here is called orbital part of the maxillary bone, which make up the floor of the orbit. And here the maxillary bone is basically engulfing the teeth around here, making a socket for the teeth. So mandible, the mandible is divided into ramus and body, and there's an angle of the mandible around here just. So here you get a temporomandibular joint. So this is a detailed view, as this shows the bone as we already discussed. This is the frontal bone, the parietal bone, the temporal. There's a femur, and this basically is maxilla around here, and over here is the femur. Sorry, this is zygoma. This is the femur, and over here is maxillary bone, and this is the mandibular bone. So going to the lateral view, these are the same bones but showing on a lateral view. So this is the frontal bone over here. This is the parietal. This is a temporal, and this is occipital bone. As you can see in the next slides, parietal, temporal. There's nasal bone, zygomatic arch and bone, and this is maxilla. This is mandible, and the sphenoid bones just around here, which usually make up the base of the skull. And just above the sphenoid bones, there's a sella turcica, which engulfs, which houses the pituitary gland. So this is the occipital bone, and over here is the mastoid process. As you can see, just above the mastoid process, there's a black hole around here that is called external auditory meatus. So many of the important nerves, they pass through here. So coming to the sutures of the skull, there's a coronal suture which goes all the way just behind the frontal bone, which is making up the patch with the parietal bone over here. So the suture which is present between the parietal bone and the frontal bone is called coronal suture, as you can appreciate here, and it goes all the way along from the other orbit to the other side. So there's one sagittal suture just in between, which usually separates the two parietal bones. So this, if you can see around here, this is the sagittal suture. Over here you get a lambdoid suture. This lambdoid suture basically separates the parietal bone from the occipital bone, and this is a junction where both the bones meet. And here is the temporal bone and the parietal bone, and the junction between those temporal and parietal bones is the squamous suture. Okay, so around at the point of the coronal suture and the sagittal suture where the both meet is an fontanelle, which is called anterior fontanelle, which usually bulges in children if they are having an infection in the brain, let's say an encephalitis or meningitis. So this usually closes around 18 months of age. So this is an anterior fontanelle over here in the coronal and sagittal suture where they fuse up, and the fusion of the sagittal suture along with the lambda suture over here is the posterior fontanelle. So coming back to the skull fractures. So a skull fracture is basically a break in the cranial bone. So there are multiple types of skull fractures and there are many causes. Just like an impact or blow to the head that is very strong enough to break the bones. Concluding to the symptoms that indicate a fracture, that includes swelling and tenderness just around that area of impact. Let's say if the blow comes from front, so there can be a facial bruising also. There can be bleeding from the nostrils or from the ears. That indicates a basal skull fracture. Apart from that, there could be leakage of the central CSF, which is the cerebrospinal fluid. So that could lead to rhinorrhea or maybe otorrhea. So coming to the types of the skull fractures. So depending on the force of the blow and location of the blow and the shape of the object which is making the impact with the head, there are multiple types of skull fractures. A pointier object which is more likely to penetrate to the skull, such as the ground, or maybe a sharp instrument like a knife or a bullet, that can cause skull fractures, but simultaneously it can cause brain injury also. And after the skull fracture on the brain injury, there can be differing or varying level of consciousness in patients, and there are different types of fractures that lead to different level of injury and trauma. So coming back to the types of the fractures, this one called closed fracture. Closed fracture is basically one when there is no break in skin continuity, and the fractured bone is not separated apart. It's just like both the bone fragments that are fractured are in continuity with each other. So that is a closed fracture. This one called open fracture. In an open fracture, this continuity of the skin is broken, or the bone emerges out of the skin. That can be also a compound fracture. So this one called depressed fracture. A depressed fracture is one that causes the skull to indent or extend into the brain cavity. Displacement of about more than 1 millimeter is significant. That needs urgent intervention, preferably a neurosurgical intervention. So, coming to the basal skull fracture. This is also one of the type of the skull fracture. It usually occurs around the floor of the skull in the areas of eyes, ear, nose, and back. So as you can see here, this area which is basically made up of the sphenoid bone and the temporal bones, and where there's a junction, and this area is called the base of the skull. So a fracture over at this surface can lead to deleterious effects. This can also lead to depressed level of consciousness, may can lead to injury of the spinal cord or brain tissue, and can lead to CSF drainage from the ear or from the nose. This can also lead to a hematoma formation or bleeding from the ears, and can lead to raccoon eyes, which is basically kind of a hematoma formation just in the front of the orbit that shows like a black colored eyes. So 70% of the skull base fractures they occur in the anterior fossa. 20% of those they occur in middle central skull base, and just 5% of those they occur in middle and posterior cranial fossa. In addition to the above fractures, there are certain other types of fractures, like a linear fracture, which is just going in continuity in a straight line, and this one called Greenstreich fracture, which is an incomplete fracture that indicates that either the cortical breakdown is not complete and both the cortices are in contact with each other, and one called comminuted fracture. So the bone can be broken into more than two sections. This is called a comminuted fracture. So there are some signs of basilar skull fracture, such as battle sign. So battle sign indicates a bruising just at the mastoid area. This indicates that the patient is suffering from a base of skull fracture. This is a battle sign. It comes from the military term. And these are the raccoon eyes. Raccoon eyes are basically hematoma formation just in front of the orbit that are also indicating the base of the skull fracture. So, causes of skull fracture. Skull fracture, this occurs when a force is strong enough to break the bone that hits the skull. Any type of impact to the head can cause a skull fracture, like being hit with an object, falling and hitting the ground, injuring the head in a car accident, or any other type of trauma. So, in some cases, as an open or depressed fracture, it may be easy to see that the skull is broken. Sometimes, though, the fracture are not obvious. Coming to the symptoms of the skull fracture, so there can be bleeding from the wound, which is caused by the trauma, or there can be bruising around the trauma site, just around the ears and behind the eyes, as we have already seen raccoon eyes. And apart from that, the base of the skull fracture can also lead to the mastoid bruising, which is called battle sign. So there can be severe pain and swelling and redness around the trauma site. Other symptoms that could include headache, nausea, vomiting, blurring of the vision, restlessness, and could lead to confusion. Apart from that, excessive drowsiness and fainting. Maybe that can also lead to seizures. So as you can appreciate here, these are the raccoon eyes and bruising, and this is the battle sign. So, how do you diagnose a skull fracture? The initial step is to examine physically. Palpate for any surface area of tenderness around the skull. Feel for any depressions or any bridges in the skull. And then the initial investigation is X-ray, which usually penetrates through the soft tissue and it provides an image of the bone. Though it's not very useful in base of the skull fracture or in a patient of multiple fractures that warrant a CT scan. So the CT scan is the most useful and investigation of choice for the base of skull fracture or any other skull fracture. So this typically provides the clearest picture of the fracture. This and as it produces the 3D images of the brain and the skull. MRI is also very helpful to delineate the bony fractures and the soft tissue injury. So, coming to the treatment of the skull fractures, there's two options. Initial one is conservative, the second one is operative. So, the management option depends on several factors, such as patient's age, his mental condition, his medical history, his type of fractures and its severity, and any other associated brain injuries like subdural hematoma or extradural hematoma in some cases, such as base of the skull fracture. So you can use medication to control the pain, and if there are no sinister signs like loss of consciousness or any intracranial hemorrhage or bleeding, so these skull fractures can be managed conservatively. However, they may require surgery if there is an excessive leakage of the cerebrospinal fluid, and if the skull fracture is depressed, which is about more than 1 millimeter, which is about more than 1 centimeter. So that is basically a indication to operate. So surgery to correct that depression is necessary and preferably should be taken up by the neurosurgical team. Apart from that, antibiotics are helpful in preventing any infection, encephalitis and meningoencephalitis. Painkillers are very good, and that usually keeps the patient to calm. If patient is having any episodes of seizures, so anti-epileptic drugs such as lorazepam or diazepam, they can be given. And apart from that, if someone suspects a raise in the intracranial pressure, so an intracranial pressure monitoring device is necessary, which is called an intracranial monitoring pressure monitoring system. So a probe is basically inserted in the brain tissue that usually monitors the pressure of the brain. If intracranial pressure raises, that can lead to depressed level of consciousness, bulging of the fontanelle, and papilledema, along with that seizures and other symptoms of the skull fractures. In that scenario, multiple efforts are basically employed to reduce the pressure in the brain, such as keeping the patient in a supine position with head and elevated, giving high flow oxygenation, using of mannitol, or to go ahead with hyperventilation, and ultimately ventilators can be used also. And if it doesn't help, then a intraventricular drain can be used to pass in the brain to relieve that intracranial pressure and to go ahead with the surgery like craniotomy or craniectomy, depending on the condition and a neurosurgical consultation. So coming to the prevention of the skull fractures, they can be prevented. Let's say if one is going for any games like cricket, so best is to wear a helmet. If you're going for riding a bicycle or maybe a motorbike, headgear is protective headgear is compulsory to prevent any head injury. And such fields like football, rock climbing, or any other adventure where a protective headwear is necessary should be employed and should be used to prevent these skull fractures. So thank you.